Hello, today is Wednesday, March 11, 2020. This is the Standing Committee on Health and Social Development. First thing, can I get a motion to adopt the agenda? So move. Jamie Fox. Today we have in the committee Sydney McEwen, Jamie Fox, Heath McDonald, Trish Altez, and Hannah Bell will be along very shortly. First thing I want to bring to your attention is that this month is Epilepsy Awareness Month, so we're going to be looking at doing a couple things with epilepsy, and just want to make sure that the public is aware. Another thing, on behalf of this committee, we're aware too of the coronavirus and how it's affecting Prince Edward Island, and just want to at this time, we've talked about having the Chief Public Health Officer in as well, but I think she's doing a great job, and want to recognize her and her great staff for all the hard work that she's doing keeping Islanders safe. So at this time, we will move on to our briefing this afternoon. We have Julia Hartley, the association's coordinator, and Katie Murray, the program client, on behalf of the PEI Lung Association regarding sleep apnea and the association's Sleep Apnea Refurbishment Program. So welcome to the committee, and we're looking forward to your presentation.
Thank you. Let's go.
Yep.
Okay. I guess I'll stand up. Hi, I'm Julia Hartley. I'm with the PEI Lung Association. So this morning I'm not going to take too much time, but I'm just going to go through our program and why we feel it's was important to highlight the program at the Standing Committee today. This is Katie Murray. She is one of the clients from our Sleep Apnea Refurbishment Program who received a machine from us last summer, and she's going to talk in a little bit about kind of how the impact that our program had on her life. So the PEI Lung Association, our vision is optimal lung health for all Islanders. So this may vary depending on the Islander, but...
Sorry, a couple of technical issues we're having, if we could just take a moment.
No problem.
I'm actually getting the booth on.
I can say.
Can we take a brief recess, actually?
Yeah, we'll take a brief recess. Thank you. We'll continue with the presentation.
Okay. So as I was saying, so the PEI Lung Association, its vision is optimal lung health for all Islanders. We assist Islanders in promoting, improving, and participating in their lung health through education, advocacy, and research. And our top 3 priority areas include COPD, tobacco reduction, and sleep apnea. So now I'm going to talk a little bit about sleep apnea. Often there's not a lot of understanding around sleep apnea. I started at the Lung Association about a year and a half ago, and I have to say I had little understanding about sleep apnea. So sleep apnea is a chronic ongoing condition that disrupts sleep. For those with sleep apnea, they have pauses or apneas in their breathing during the night that can last seconds to minutes. So often those with sleep apnea awake many, many times a night. So they could stop breathing up to 30 times an hour. Those in our program usually have moderate to severe sleep apnea, so they would be stopping to breathing about 10 to 40 times a night. And it's the number one cause of excessive daytime sleepiness. So often we find there might be not a great understanding around sleep apnea. People might say, oh, well, my uncle, he's always tired and he falls asleep at dinner. It's so hilarious. He's a really big snorer, but these are signs of a serious condition that can be treated. So some of the negative long-term consequences include high blood pressure, heart disease, stroke, prediabetes, diabetes, depression, and increased risk of motor vehicle collisions. So these are for individuals that have untreated sleep apnea, so that would mean that they're not receiving Cpap or BiPAP treatment. One of the most serious is increased risk of motor vehicle accidents, because those that fall asleep at the wheel, could harm themselves and others. So by not sleeping properly, we all know how we feel, after having a poor night's sleep. These individuals have that every single day. So it can put a lot of pressure on your heart and on your lungs, and can increase, comorbidities that an individual might have. So in PEI, there's about 10,000 islanders with sleep apnea. We have no provincial support currently for sleep apnea treatment. Those with insurance plans, sometimes the insurance providers won't cover sleep apnea, depending either on the plan that you have or on the severity of the sleep apnea. So if it might be a sort of mild case of sleep apnea, often insurance companies won't cover it, though it does still impact the health of the individual. So the issue is just that basically, although we have 10,000 islanders or so with sleep apnea, there isn't provincial support. So many islanders are faced with paying between $1,500 and $8,000 for the Cpap or BiPAP treatment. Typically it's about $2,500 for a Cpap machine, plus the masks and tubing, cost of appointments to go to a sleep clinic, because they're all private sleep clinics. So for many individuals that we receive calls from, this is an expense that they just can't afford. It's completely out of reach for them. For many islanders, they're on fixed incomes or low income. So approximately 30% of all islanders do not have private health insurance and cannot afford the machine treatment. So as I said before, so patients awaiting sleep apnea machines statistically have more comorbidities that impact their overall health. As well, patients with untreated sleep apnea use about 2 times more healthcare resources compared with their matched control patients. So if a patient has untreated sleep apnea, typically they would use more specialty services, they would use higher drug costs, and they would be, there would be more hospitalizations of that individual. So by treating sleep apnea, that's why our organization has decided to invest in it, because we really believe that we are helping to reduce the burden on the healthcare system, as well as help individuals live healthier lives. So now I'm going to pass it over to Katie. Katie received a Cpap machine last summer. Our program started in April. She received a call after seeing our interview on Compass, and she did receive a machine after a couple months, so she's just going to tell a little bit about her story.
Okay. My name is Katie Murray. I'm 26 years old. I think I was 25 at the time when I was diagnosed with severe obstructive sleep apnea. My doctor sent me for testing because I was feeling tired to the point of lethargy on a daily basis, was putting on a lot of weight in a short period of time, and was feeling severely depressed. When I got the diagnosis of sleep apnea, I was relieved because it meant there was an answer as to why I was feeling this way. However, I was also very upset because I knew that my health coverage plan, which was under my parents' plan, had recently ended due to my age and the fact that I had graduated university. I felt helpless knowing that I had a serious medical issue but could not afford to treat it with a Cpap machine. Fortunately, my sister told me that she saw something on Compass on TV recently that would turn out to help me immensely. She had heard of the PEI Lung Association Cpap Refurbishment Program. I did some looking into it myself, and it was a really simple process from there. Basically, I just had to send my sleep apnea testing information from the private clinic to the PEI Lung Association, and within a couple of months I had my Cpap machine. I'm very grateful to the PEI Lung Association for this program because I know that if it had not been for this program, my sleep apnea would have gone untreated and my health in my mid-20s would have continued to deteriorate. Since being treated by the Cpap machine, I no longer feel drowsy while driving, which was a serious issue prior to treatment. I have also lost weight and am feeling more energetic, and additionally I would say that my mental health has stabilized and I'm feeling much happier overall because I'm able to work and not fall asleep and have a lot more energy to direct towards my goals. Thank you.
Thanks, Katie. Okay, so I'm just going to finish up my presentation. So I'm just going to go through how our program works. So we have sort of 4 components to our program. So program promotion, which is an important aspect of our program, machine collection, refurbishment, and machine delivery. So program promotion, this is an area that we kind of struggle at when you're trying to run a program on very little funding or the contributions of Islanders. So we have partnered with the Lions Club to recently create this poster that we're going to be sending out to the Lions Clubs shortly. We also promote our program through social media, through our website, through presentations such as today, as well as through our newsletter. The Lions Clubs do a great job of helping us to collect the machines, which I'm going to talk about in a second, as well as promote our program. We also promote our program to acute and primary care centers. So, Health PEI helped us send out this information out to their physicians and to their nurse practitioners. So sometimes we do get referrals from them. I think that there's still work to be done to have more Islanders aware of our program. As well, we have referrals mostly coming from sleep clinics. So there's 5 private sleep clinics across the island, and the majority of our referrals come from there, from patients that are identified as not being able to afford machine treatment. So the second component is machine collection. So we collect the machines at our office at the Volunteer Resource Center across the street, through the sleep clinics, through the Lions Clubs. So the idea is that Islanders can drop their Cpap machines off to any of the 22 Lions Clubs across the island, and they'll help us get them back to Charlottetown. So it's a partnership that we're really happy about. This program we adapted from the Nova Scotia Lung Association. So they already had the model in place with the Lions Clubs helping. So that was it was really great to just kind of take the blueprint for the program and move it to PEI. We also have support from the QEH and from some physicians' offices for machine collection. So often Islanders don't have to go too far to drop off a machine. I find if people call me, I try to help them to find somewhere right away, because sometimes we have the good idea to clean out our basement, but next week we might not be feeling quite so energized. So refurbishment. So currently refurbishment is happening at the Lung Association of Nova Scotia in Halifax. This is also a bit of a barrier for our program because we have to rely on volunteers to transport them back and forth. So typically every couple of months we'll have a volunteer who's traveling over to Halifax, bring a carload of sleep apnea machines, and then we have the Dalhousie University respiratory therapy students refurbish the machines as part of their course. So the prof actually comes to the Lung Association and goes through how to refurbish them at the site. So to be eligible for our program, there's not too much that you have to go through. You just have to show proof of your sleep apnea diagnosis. So typically it's a sleep study you do, where they test your sleeping for 24 hours, and that can be done free of charge at any of the sleep clinics. They sign a program waiver. They just sign off that they have no private health insurance, or that their health insurance doesn't cover the sleep apnea machine. And then they have their machine set by a sleep specialist. So we're just in charge of the providing the machines. We don't do any of the follow-up therapy or anything like that, because we're not trained in that area. Finally, the machine delivery. So currently we have them refurbished in Nova Scotia, and then we charge the clients a $35 delivery charge to have them sent through COD through Canada Post. Again, this is not ideal because often some of the clients I deal with, $35 is even a barrier for them. This is something that we'd like to refine in the future, but this is where we're at right now. So program benefits. So as Katie said, it provides a new lease on life for many islanders affected by this condition. Medical costs can potentially be cut in half for those that are using sleep apnea therapy optimally. The overall health costs can also be reduced, and it reduces electronic waste to landfills. So sleep apnea machines, if they're no longer needed, are basically just thrown in the garbage. There's no method for recycling these machines. So by our innovative program of cleaning them and having the respiratory therapist do the refurbishment and changing the parts and that kind of thing, we can actually reuse these machines. So we think that is great. So how we address sleep apnea. So since we started our program in April, we've given out over 80 machines to islanders in need. This is both the Cpap and the BiPAP machines. We don't really get very many BiPAP machines. That's also a current gap in our program. We've only received about 3 that we've given out. We have a list of about 30 people that are currently in need of BiPAP machines and aren't able to afford them. So a BiPAP machine costs about $8,000, and for many islanders, this is completely out of reach for them. So we feel that this has generated over $200,000. That's supposed to say in savings for low-income islanders. And so we have a lot of program partners that help us with this program. So we have Dalhousie University, the Lung Association of Nova Scotia is a key player, PEI Lions Clubs, the sleep clinics, and Health PEI. I'm just going to take a sip of water. In addition to providing these machines to islanders that access our program through referrals, we also have delivered about 16 sleep apnea machines to the QEH Cardiorespiratory Services Center. So what they do is if there's a client that's in the hospital who is unable to leave because they don't have a sleep apnea machine, they will receive one right away. The idea is that we want to reduce the amount of days that clients are unnecessarily in the hospital. So sometimes a patient won't be able to leave the hospital until they receive a sleep apnea machine. So through this partnership, we've helped them to get the patient released as soon as possible and get them home and where they can be recovering safely. We're really happy with our program. It's been almost a year since we started. However, we're really struggling right now because we feel that we have people calling almost daily to access our program. We don't really have the capacity to keep up with the amount of donations we're collecting. So we're looking at increasing our program promotion. We hope to collect more machines to raise awareness about sleep apnea in general and to reach more islanders in need. Often islanders who go to a sleep clinic will access our service, but we're not reaching people who say have been to a sleep clinic 3 years ago and know that they have this condition, but they know that they also can't afford it. So I don't feel like we're doing a great job of promoting our program to islanders just generally. I think it's only through specific points of access. We're also hoping to expand to have local refurbishment, so that would mean that the machines don't have to be sent to Halifax. We would have the supplies here locally, we could be able to refurbish the machines quicker and more efficiently. We currently have a wait list of over 50 islanders. So we feel that, if we could refurbish these locally, then we would greatly reduce our wait list. Although we don't have a program like Dalhousie University does, we have a lot of willing volunteers that would help us to refurbish the machines, as well as we could pay people to help us. They have to be trained respiratory therapists. It would also reduce transportation costs, as well as pollution associated with that. So program staffing is also an issue for us. So by having proper staffing, we would expand our program, reach more islanders, and run our program more efficiently. Just generally, I think that over the last year, for me, it's been, my work is more behind the scenes. I don't get to actually talk to a lot of clients. My background's public health, so I've really enjoyed the last year of talking to clients face to face. People call us in desperate situations, and this is a program where we can actually really help them out. I've had many people on the phone in tears with me, either happy tears because they know that they've found a solution to their problem, as well as just frustrated. If they're looking for a BiPAP, we can't really help them out there. So, I think that we have done a really great job in taking a small program and sort of with the partnerships that we have in place and really bringing it to the island. I think there's still a long way to go, though, in a lot of ways, just to make sure that every islander has, like I said in our beginning, optimal lung health, and that we are addressing sleep apnea and really helping those with low income and that couldn't otherwise afford it. So it's my presentation, but if anybody has any questions.
Well, thank you very much. Yes, we'll start with Jamie Fox.
Thanks, Chair. Thank you very much for coming today on your presentation. I'm interested on the funding side of things. Where do you get your funding from right now, presently?
We currently get our funding through the generosity of islanders. So we do direct mail campaigns, and it's just basic people giving us just donations. We have applied for a range of grants. We have received a few small ones from some companies, but nothing over a couple $1,000. So
have you applied to any government grants in the province?
I don't know if there's anything specifically that would refer to this program. I find often our criteria isn't met, but I can't specifically say that there's a government grant we could apply for, but we have spoken with the Minister of Health about our program, and he did seem willing to help us in some capacity in the future, but nothing's really been kind of ironed out.
So what I'm wondering here is, under the Department of Fisheries and Communities, we have the Crown Corporation of Rural Development.
Okay.
And I'm wondering if there's not maybe some avenue here that you could look at. It applies to all nonprofit groups across the island and has a very wide variety of programs that are available to nonprofit groups. So I'd encourage you to reach into our staff of rural development and have that conversation with them, because there might be something there that could possibly apply. But with that, I'm very interested in the refurbishing of the machines, and I'm wondering why we could not do that here in the province to lessen the burden on going off island.
Oh, we definitely can, and I think that we will be doing it in the future. Just currently, like I said, we're running this program on what I'd like very little funding. So we would have to buy the supplies that would it really just comes down to funding. But I do feel like we have the expertise on the island. Even on our board alone, we have 3 respiratory therapists who have already said they've been willing to help. Places like the Snore Shop, they also will pay their employees to go and volunteer for a day. I think that there are some opportunities for that. We're definitely interested. It's just I think this being a new program, and also myself, I might not be aware of all the opportunities that are out there, and I think that's kind of why we're here doing presentations like this, to kind of better understand what opportunities there might be out there for funding this program.
Okay.
Fox?
So with that, as the minister responsible for that department, I'm willing to commit to looking at a funding application to help you do that here in the province.
Great. Yeah.
So we can always chat after and put you in touch with rural development.
Okay.
And look at how we could fund that equipment in some kind of model here for you to assist with that.
Okay, great. Yeah, no, that's definitely something we're interested in, and I think that we, could find space even in the building we're using currently. It just comes down to sort of the staffing and the equipment required.
Because I can see that really would speed up the process with helping
Oh, for sure.
the young lady, especially, right?
Yeah.
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 Okay, thank you very much.
Thanks.
Trish?
Yes, thank you. Thank you, Chair. So you had mentioned that the sleep clinics provide the testing free of charge, and I just wanted to clarify, so how is that funded? Did they just absorb the cost of that, or does that come from Health PEI to cover the cost of it?
No, it's actually an interesting relationship. So basically, the sleep companies, how they provide the testing free of charge is that they absorb the cost when they sell a machine. So they say, we're going to give you a free sleep test and a 30-day trial. So they send the patient home with 30 days of the Cpap machine for 30 days. And then at the end, typically they would purchase a unit. If they're unable to purchase a unit, they send them to us. At first we thought that the sleep clinics might not want to work with us because they would be losing business, but they're actually overly excited to help us out. They do still get some funding, like money through clients still have to pay for their own masks and tubing, so that's $200 to $300. As well, they do get a bit of money to set up the machine, so maybe less than $100 to just take the time to set up the machine. So currently, Health PEI is not covering any of those costs. Those are the private companies that would be absorbing those costs.
Trish?
Thank you, Chair. And you mentioned that when someone receives a machine through your program, they also have to work with a specialist to calibrate the machine or something along those lines. So would those specialists be out of those sleep clinics as well then? Is that part of the partnership? Yeah. Okay, great. Just one more
Trish?
question at this point. So how long does a sleep apnea machine usually, what's the lifespan of a machine like this?
An insurance company will say it's 4 years, so they'll replace it every 4 years. However, we have clients that come in with a machine that's 15 years old and they're still using it. So, I would say sort of that 5 to 10 years is the typical lifespan of a machine. What we find is just the technology gets out of date. It's not that the machine actually breaks. So that's usually why they have to replace it. It doesn't match the settings, but a machine can last an individual quite a long time.
All right, thank you. That's all for now, Chair. Thank you.
Heath?
That was a good question, Trish. That's one I was going to ask too. So you say, just get these numbers right, approximately 30% of all Islanders do not have private health insurance. You mean just out of those 10,000 Islanders that...
That's just a general figure.
Okay. But
Yeah.
you're not talking about from 162,000 Islanders, you're talking about the 10%, 10,000 here.
So the 30% would just be, so I would say like 50,000 Islanders don't have insurance.
Oh, okay, so you are talking
Yeah,
the population.
I'm talking the
base. I
population.
thought you might have been talking just the
Yeah.
10,000, okay. So the cost of the machine, you said is 8,000 approximately? for a new one?
Well, it ranges from about 1,500 to 8,000. So a BiPAP machine is closer to 7,000 or 8,000, whereas a Cpap machine is only 15 to sort of 3,000, depending on the type of machine that you
And you said
have.
you had 50 people online are basically waiting for a machine.
Yeah, and we have people calling like
Oh,
pretty
okay.
much every day. Yeah, so it's become a large part of my job. We're we're very happy that people are finding out about our program, but capacity-wise, it's becoming a bit of a challenge for us for sure.
So I guess your next step then is to break down for the minister how many machines you actually need and what type of machines you actually need for your application. Because I think kudos to you, Jamie, for stepping up, or Minister Fox for stepping up and doing that, because I think it's something that you really don't know anything about unless it actually affects you. It's one
Yeah.
of those, and it's good to hear it. So it's good to hear your story, Katie. So that's all, Chair. Thank you.
Okay, thanks.
Yeah, I'll just ask a couple of little questions. The number's 10,000. This program seems like it might be a little bit behind the times. Like it's just coming on board now. Compared to other provinces, are we behind?
No, we're actually ahead of the game. So Nova Scotia Lung Association was the first province to run this program, and we're the second. Nowhere else in North America are they running this program. Yeah, I think some places, I think there's some liability issues maybe they're concerned about, or maybe they just don't want to take it on. Other provinces do cover sleep apnea therapy to some degree, such as like Saskatchewan. So I do think, there is definitely other provinces that are providing their residents with sleep apnea therapy. But, I think that our innovative program is is helping to meet that demand. So yeah, I wouldn't say we're behind in this program, but I do think that there is a gap in sleep apnea therapy generally on PEI.
Yeah, so just looking at since 2019, so this program's good, but sleep apnea, it's nice that you're here because it is a big issue. If it's not treated, if you don't treat sleep apnea, you mentioned it being a burden on the healthcare system. Mm-hmm. If it's not treated, what happens? How does that affect the healthcare system down the road?
So generally, as I said, it usually costs the healthcare system about 2 times as much in many of the costs associated with having an individual who may develop diabetes a lot sooner. They also puts pressure on your heart. As you can imagine, if you're not sleeping, so your body isn't getting the rest it needs, then you're going to be more prone to be getting sick or getting some chronic conditions. Maybe Katie, you can answer that how you felt different after.
Sure. Yeah. So definitely more energy. And like more alert for driving, like I said, so that was important to me, and for working. Also, like, weight gain is big for whenever it's untreated. So that's like, obviously obesity is going to contribute to like a lot of chronic conditions down the line. And then like depression too. My mood has improved a lot. So those were like the main areas of my life that have changed. But yeah, that's all I can really say because I can just speak for myself.
And if I know it's great that the Minister Fox spoke up about potential funding or applying to them. Mm-hmm. If you were to talk and ask the province, how much funding would you need to maintain or take this program to the next level as a director of your program? How much funding would you want from the province?
I think in the range of like $50,000 would probably be what would be required in terms of creating an entire refurbishment center, hiring somebody on a part-time basis to manage the calls, as well as invest in the equipment. So we'd spare parts, the equipment to refurbish the program, refurbish the machines, as well as the ongoing costs of having a separate space for this, as well as to promote the program. So last year, around this time, the Lung Association Nova Scotia received a much larger grant through their government, and they were actually able to run some ads on TV. And I think that having that extra fund to do some promotion work really helped them kind of take their program to the next level. From there, they also received more donations from some of the companies even that were interested in supporting their program. So I think that when people find out about your program, things just sort of start happening, right? But when you're still trying to promote it with posters on lampposts and stuff, you can only go so far, right? So, yeah.
Perfect. And then the last question: if we were to provide a report to the Committee of the Whole or the Legislative Assembly in a month, what would a couple key points be you'd want to see in that report?
I think that really the message that we're trying to get across is that this is a gap currently for many islanders. Many islanders are living without Cpap therapy, and they do want this therapy, and they do need this therapy to live healthier lives and to be more productive individuals in society. So I think that just generally, I would like to, raise more awareness about sleep apnea. As I said, it's something that I think that's very misunderstood, as well to better understand understand, how some of these partnerships can develop and some of the innovative stuff that we can do, working with, government and for-profit and nonprofits, and all kind of working together to better benefit Islanders and make sure that they have the best lung health they can. So I think that, just around the key points, those are what I think is important. Also, just that, I think that the more Islanders that receive this treatment and the more Islanders that benefit from our program, I think that it can really improve people's lives, for sure. Yeah.
Just a second round. Okay, well, thank you very much for coming in today, Katie and Julia.
Yeah,
You did a
thanks for having
fantastic
us.
job. So what we'll do now is we'll just take a short break,
Yeah.
and we'll clear the room. You can have a quick discussion, and we'll be right back.
Thank you.
So at this time, we'll move on after our presentation to agenda item number 4, which is new business. And I do have the committee received a request, so I might just speak about that and get the committee's input on it. So we received a request from the Charlottetown Professional Firefighters Association, and it was sent to us by the president, Spencer D. Waite, and they're requesting to come in and speak to The committee, fire protection in the capital area, in their opinion, there's nothing more important than the safety of Islanders. So there's a few gaps that they would like to speak about, and they think there's a few deficiencies in relation to comparable municipalities and solutions that work in those communities. So just wanting to get input on their request to come in and speak to the committee.
So I'm just wondering why our committee?
Jamie Fox?
Thanks. I'm just wondering why our committee?
Yeah. Well, if you look at our mandate, we do have justice and public safety emergency measures in this committee. So that would be the reason why. Trish?
Thank you, Chair. Just curious, do you, I don't know if you have any further information beyond this email, but I'm just wondering, are they talking about other jurisdictions on the island or off island, like comparing what we're doing here versus other?
I think what they're talking about is comparing with our population growth. Our city is getting, or Charlottetown is getting a little bit larger, and they're looking at their services in comparison to other comparable municipalities out of province, and the way they run their fire safety protection services. Trish?
So I would suggest that maybe, if we decide to move ahead with this, that we might expand, to other, the Firefighters Association more broadly across the island as well, rather than just targeting on Charlottetown, which will be an interesting discussion. But if this is a topic we want to explore through this committee, it might be worth inviting other, I don't know, Minister Fox would probably have a better idea of how many associations there are across the island that we would contact about this, but just, I don't know, that's...
Yeah. So you got the, yep. Jane?
So what's the title of this, where's the request coming from?
Charlottetown Professional Firefighters Association.
I would say reach out to the PEI Association of Firefighters. Go to the provincial, if you're going to look at it from the bigger context, which represent all firefighters across Prince Edward Island, and have the conversation with them. I can say that I have had a lot of conversations with municipalities over the last while, and what I'm hearing is that they're concerned over the mental health issue of firefighters responding to so many calls in regards to first responding and accidents and the toll that's having on them. And I can tell you that municipalities are concerned over it. The associations are concerned over it. So I would my advice would be for the committee to reach out to the PEI Firefighter Association.
Okay. Hannah?
Thank you, Chair. Just to add to that and some additional context, I think, to my colleagues, because we did have, some members of our caucus did have a meeting with these representatives as well, as I think you did, Chair. And there's the additional context for the Charlottetown, which, adding to the very important comments that my colleague made around mental health pressures, is the staffing ratios for the City of Charlottetown in particular, where there are paid staff as well as the key volunteer firefighters, and how those staffing ratios have not been changed to reflect the growth of the municipalities. There's some discrepancy in terms of the ability to cover two different fire districts, Fire District 1 and Fire District 2. And then there's also, a significant concern, as we heard from a mental health perspective, but also about the capacity to respond in terms of the number of people who are available on shift and the time it takes to get there. I know that when they did come in to present to us, they had referenced sort of some evidence that would be of assistance in us helping to understand the context of the need, and that was the fire protection survey for the Charlottetown Fire Department that was done in 2019. I haven't been able to find a copy of that report, Chair, so maybe that's something that the legislative committee can compel or to find. So that'd be the 2019 Fire Protection Survey of Charlottetown Fire Department. And it was done by John T. Redden, R-E-D-D-E-N. As well as there have also been, in the same year, a Charlottetown Fire Department environmental scan. So I think both things are potentially, Chair, maybe we could consider both the perspective of the provincial need for municipalities' need, but there's a specific context for the Charlottetown ask, which is unique perhaps to Charlottetown. And I would really appreciate it if we could consider both in that context.
Okay, so that's a very good input. Anybody else? Well, we can continue to discuss this. I think I just wanted to ask a question to the committee. Are we looking at two different things now? Or I do believe that it's important that this group come in and speak to us. But can we extend an invitation out to the provincial side of things as well?
Chair, I have no problem with that. Then you'd not only hear where they're raising the concern on the city side of things, then we might be able to hear, okay, is there a further concern on the provincial side of things? So it could be like an A and B part to it.
Yeah, definitely. Perfect. Yeah, perfect. Okay. So we will respond back to this association, the Charlottetown one, and send a request to the provincial one as well. Request a copy of that document, and we'll send it to the committee once we receive that document, the report. And yes.
Sorry, do we have motions on the floor for any of these, or do we take them as consensus?
Consensus?
Yeah.
Consensus?
Okay.
Consensus.
So if we're doing consensus, just to clarify, we're reaching out to the provincial organization, as the minister specified. We're getting back to the Charlottetown folks, and we're also looking for the documentation that MLA Bell mentioned.
Yes.
Yes,
Sounds
okay.
good. Perfect. And then again, I'm not sure we'll be able to have them in before our sitting in April, but it would probably be priority soon thereafterwards, in hopefully the month of May, June-ish. So they will have some time to put some things together. Any other new business at this time? So at this time, we will. Jamie Foxx?
Yeah, the only thing I will bring up is, I think we have to be aware of the fact that, what day is this, the 11th of March? We're going into the House on the 7th of April. And that, if anything, I would personally like to see not very many meetings scheduled between now and the House and during the House session, so that we make sure that we concentrate on issues of the House and them type of things, if that could be a suggestion.
Perfect. So suggestions on the floor. Does anybody want to? Trish?
Sure. I think that's certainly a valid point. One thing to note, though, is the work plan, you already have meetings set up, so I think that perhaps it's a little beyond, we can't just, cancel meetings that we've already scheduled, so I'm not sure there's much more to be done there, but I would agree that perhaps during the sitting, to focus on, be able to focus, maybe don't schedule meetings then.
And I don't believe we are scheduling meetings for the sitting. So that's confirmed. But leading up to it, I think we can let Sean talk about that. We are going to go in camera here in the next few minutes to talk about the work plan and get that looked at. But
So I guess the point would be,
Jamie?
here would be, let's not schedule any new meetings until after
Sure. Yeah.
the session.
Yeah. Sounds good. Well, that'll be noted. Great. So at this time, I think we'll go in camera and
Motion from one of the members?
to go in camera.
Yeah.
Okay. I'll need a motion to go in camera. Heath McDonald. Yeah. So in camera we go.